DEIC. Just answering one of our ceasefire texters there. What happens if you're assaulted by a large crowd? We were talking about the single shot. Maybe ultimately in the future the only thing allowed. And I just said reload fast, aim correctly, and pray earnestly. It's about all you can. It's about all you can do. All right, it's Richard Roberson, and that makes sense because he is the Vice President of State Policy and General Counsel, Mississippi Hospital Association. Did y'all quarantine Tim for the time being, or what?
Tim is actually out of town in a business meeting, so you get the second team today.
No. It's always good to talk to you, sir. Appreciate it very, very much. I have a question here. You really don't have to comment on it, but it does bear a question that I wonder. A chemist with the Mississippi State Department of Health has ordered the city of Jackson to enact a boil water notice. And I was looking at some of the news, and I don't think they wanted to do that. They wanted more specifications or whatever they happen to be for all of the city water customers due to high turbidity of surface water with possible disease-causing bacteria, city officials said in a press release issued on Saturday. And the mayor, Antar Lumumba, said in a media briefing the city water treatment plant is fragile and outdated, which contributes to a portion of the issue. We know that. The old system demands resources, and I think he basically said, in the state that it is, we're always going to be under emergency advisory one way or the other, paraphrasing. He said, we've retrofitted the water plant to provide sodic ash, which we believe is more present with today's standards, but does not solve the issue of it entirely. So there was apparently a delay, or was there a delay, between the time when he actually notified the citizens? I'm not sure. But the problem is not getting any better. And I wonder how in the world, I feel for the restaurants. How do they do this? How does any business survive in the city limits of Jackson, Mississippi? But what about the hospitals? What do they do when this happens?
Well, a lot of our hospitals, whether they're in Jackson or in other locations, have backup systems, or they have their own wells. And I believe UMC, St. Dominic Baptist, I believe they all have their own water well systems. So I believe that's correct. So
they don't have to draw on the Jackson water.
That's right. So they've kind of got their contingency plans in place.
Makes me feel a little bit better, to be honest with you. But this is a situation that's not going away, and we'll talk more about that a little bit later on. State of the Hospital Association, and any updates at all as far as the Blue Cross Blue Shield deal?
Well, I'm not privy to those discussions. University Medical Center is certainly a member of MHA, and we're proud to have them in. We also partner with Blue Cross Blue Shield on a lot of things. So I feel kind of like a little bit of the soggy sweat speech about our friends on both sides. I think just as a consumer of health care, we've got to figure out a way to get this right, and I think it's a shame that we're in this situation. The reality is healthcare costs have gone through the roof over the last couple of years, and exacerbated by the pandemic. And what happens oftentimes is these payer agreements are reached, and they extend for several years, and they don't contemplate the additional costs that may come in, certainly as a result of a pandemic. So you've got a cost pinch on the provider side, and I think that's what's trying to be addressed, is trying to make sure they're covering their costs.
I will say this, Richard, because I'm going through that right now, and I'm looking at some of the bills, and it's just overwhelming. It really is. Yeah. And I can see it also from the insurance side. To be honest with you, Blue Cross Blue Shield or any insurance company, where some of the charges are just astronomical, absolutely astronomical, and confusing. And by the time the whole system is broken. And nobody, all through the Obama-Biden administration, when they say they're going to solve this, it just is exacerbated, and it gets worse every single year. Nobody knows exactly what's going on. Patients basically have very few rights, and I don't know how we solve this.
Yeah, I think it's been a systemic challenge since the government got into healthcare back in the 60s.
Bingo.
You've had this thing going on. It's just run around through different cycles, and as administrations change, then you get a wild swing one way or the other in healthcare policy, and what gets left out of that oftentimes is the best interest of the patients. I'll tell you, in Mississippi, our hospitals, according to the Kaiser Family Foundation and other publications have published this information, our Mississippi hospitals are the lowest cost inpatient per day in the country. and it's really not even close. It's expensive, but it's around $1,300 a day is what it costs you as an inpatient on average across the state. Our nonprofits are the lowest. Our state and local hospitals, our for-profits across the board are all within the top 7 of the lowest expenses.
But you also have to gauge that against lowest household income, et cetera, et cetera.
Yeah, but what I'm saying is they are the lowest cost hospitals per day in the country, and so they're managing their costs. They're also 18th in quality based off Leapfrog, so we're low cost. Good quality. Our challenge in Mississippi is revenue, and a lot of that's exacerbated because we do have, when the government got into healthcare in the 60s, about 65% of our payment sources come from Medicare or Medicaid, and that's just a challenge. So it's a tough volume and a tough payer mix, and
it puts us in that loss leader column as far as attractive customers.
It makes it difficult. It just makes it difficult. Yeah. But a lot of the challenges in healthcare are simply the folks who actually consume the services oftentimes don't really either have a choice of where they get to go because someone's in network or someone's out of network, or they they end up paying more than they think they should.
Are you guys part of the National Hospital Association in that organization?
The American Hospital Association.
American Hospital Association.
Yes, sir.
You think they're doing a good job to press this, or are they just dancing along with everything else?
I think, look, there's some things that we work with the AHA very closely on. There's some things that we haven't always, agreed 100% with the things that they do. We tend to, Tim, we tend to kind of do things that we think are going to be good for Mississippi hospitals, and sometimes national organizations have a national viewpoint, and that's fine. That's what they're there for. We try to do the things that we think are going to be best for us.
I'll give you a perfect example. When Donald Trump early on talked about transparency, which you cannot disagree with that, because transparency simply means you're bringing competition to the industry. Whether it's anything in government, you start bringing competition to it, and the marketplace is going to work better for the consumer at the end with that competition and capitalism. And we passed a law. We have transparency. Has anybody seen how this is working out as far as the posting of procedures, et cetera, et cetera?
Well, you do. You're able to go on different websites and find that information. But, I would submit to you that really our healthcare system is not a free market because of that government intervention. If you're looking at going to the retail store, if you're going to Walmart, you don't see the government intruding on pricing like you do in other places. Yeah. And so with healthcare, and particularly in Mississippi, when you've got 65% of your payments on average across the state for hospitals anyway, coming from Medicare and Medicaid, the federal government or the state government sets those prices. The hospitals don't negotiate those rates. And, the consumer certainly doesn't have a say in that. And so it's just, it's a different mix. And so from the hospital perspective, 65% is basically Medicare, Medicaid.
Wait a minute. Are you talking about hospitals or public schools? It sounds one and the same.
We're getting close.
Yes. We'll talk more about this. Richard Roberson, Vice President of State Policy, General Counsel, Mississippi Hospital Association. Andy Gibson with the big hat coming in the big chair, and that will be at 8:05. Updates on the Department of Ag and also upcoming Mississippi Ag and Outdoor Expo. And what I've heard, this one is going to be a showstopper. So we'll talk more with the commissioner coming up at 8:05. I see him live in the Trustmark studio is the Vice President of State Policy and General Counsel, Mississippi Hospital Association, Richard Roberson. And I was reading this. This was last week, Blue Cross Blue Shield on Thursday. I think it was last week. So they were suing 3 employees at the University of Mississippi Medical Center for allegedly spreading false information. So, just to touch base on this one more time, I don't think this thing is anywhere close to finding a solution.
Well, it sounds like it's getting worse before it gets better, for sure.
There were some things that happened over the last several weeks. Was there a hospital up for sale? I was thinking that was in the news, or a hospital up for sale, or one closing down, or anything in your membership?
Singing River Health Systems, maybe what you're referring to. Yeah,
yes.
Down on the coast has announced that they're putting the hospital up for sale, I believe, or going through that, beginning that process. I think the state law was amended a few years ago so that they would have to first go back to their constituents and give them an opportunity through the referendum process to express whether or not they wanted the hospital to go up for sale. And if the vote is no, then it won't. But if it is, then they would entertain bids on that process.
I know what you've been doing, and many other people in this industry have been doing, testing the waters to see exactly what the temperature is of the House and Senate leaders and the governor as far as Medicaid expansion. Anything happening in the off season before the legislative session gets here in January?
Well, Paul, we've had these conversations for a number of years and come to the state with different options, similar to what Texas did. Texas did a special type of waiver program that just allows for some additional compensation to cover the cost of those uncompensated care patients. In Mississippi, over about 10 years, our uncompensated care cost went from a little over $300 million to a little over $600 million. That was pre-pandemic. It's not gotten better. The financial situation hasn't. So that's the big challenge. It's just unsustainable. And so what we've tried to do is look at different things, like Texas did a special waiver to help with compensation. Florida did something for a low-income pool to kind of help with uncompensated care, similar to what we've done for years in Mississippi, the wind pool, the high-risk wind pool for property insurance. And so we remain open to those conversations. We've proposed things that wouldn't cost the state any money. The feds have come out with a new package last year that would actually pay about $800 million for 2 years to defray the cost of the traditional Medicaid program that we already have. And while no one, in their right mind wants to see, a ton of your population on Medicaid, we're trying to live in a real world where that is the reality. Unfortunately, we've got, several folks that are working that would qualify for this type of program. And if it's not that, then, come up with something else. We just hadn't seen any other solution.
Has anybody been thinking out of the box? I remember having a conversation. I'm not going to say who it is because I wasn't clear to do that. But it was a state leader as far as a politician concerned. And he or she mentioned to me that there was an idea on the table that they could bring this in a cooperative or a joint venture or combine with several other states who are in like situation of Mississippi and put our power together to do that. And I thought, well, that seems like a good idea. We would move from that lost leader state to more purchasing power. Has that ever been thought?
We've thought of that type of model. You get in some issues with trying to do a single insurance company through that across different state lines because of the way the insurance laws are structured, where you have to get licensed.
So in other words, those are just what's stopping us on that one is just laws that could be changed.
They could be. You'd have to change them across the country in different states. But we've looked at things like that. We've thought so far outside the box. I think we've had to go get a new box. We've worn that box out. It's we've come up with probably 5 or 6 different ideas over the last few years. And
give me another one, because that one to me sounded like a pretty good idea to take to step 2.
Yeah, and Arkansas did this. They did a kind of a public-private partnership where the state helps fund private insurance plans. The reality of that is you end up paying a little bit more per person for a plan like that than if you just did traditional Medicaid. But again, it's a public-private partnership. The state helps fund some of the share. The feds kick in their share, and you go on the open market. And what that also does is it creates a more competitive insurance environment. So, getting back to the conversation with Blue Cross and UMMC, if you interject more competition on the insurance side, just like you were talking about on the healthcare side, more competition on the insurance side also helps improve quality and lower costs as well. So those types of things to increase the number of insurers in the state also could be a big benefit to the consumers as well.
Richard Roberson, who is the Vice President of State Policy General Counsel, Mississippi Hospital Association. Would you and I agree on the number one problem you have is uncompensated care?
We believe so.
Okay. How do the health departments located in every single county play into this? It seems, and I'm just asking because I'm not in the health industry, it just seems that if more money was put toward there, if people would go to a health clinic, and if they had the opportunity to do that instead of going to an emergency room, or if they had some care to take care of a cold before it turned into pneumonia, it would seem to me that investing money in health clinics above and beyond what we're doing now would be a reasonable idea.
Yeah, and the health department used to provide a lot more clinical services than they do now, and one of the reasons why they don't is, my understanding is that about probably 6-7 years ago, the State Division of Medicaid changed the way it pays for those health department services. They were being reimbursed, I think, essentially as a cost-based program to help the Department of Health just cover their cost. When we went into enrolling a bunch of the kids into the Medicaid managed care program, that changed, and they stopped that method of payment, which caused the Department of Health to not be able to cover their costs. Just like with any business, if you can't cover your costs, you don't continue in that service line. So I think that was a reason. I'm not on the Board of Health, not involved in all that.
But we made a decision that actually cut competition instead of increased competition, is what you're saying.
It would have helped provide additional access to care points for consumers so they don't have to go to the emergency department for things like, a cold or for a fever spike.
Yeah.
Now, some of that happens in the middle of the night, and those clinics weren't open in the middle of the night.
I understand that.
But, yeah, but those types
in
of things help.
in the same way, though, when CHIPS came in, instead of being charged at a health clinic a nominal fee, it was better to go to a hospital and have it done there because it was taken care of. Basically, that's what you're saying.
Well, and with the CHIP program for kids, you saw just a ton of kids get on that program. I'll say a ton.
It was 200,000. I think it was 200,000.
Well, I think we've got about 50,000 or so CHIP kids now. I think the highest we ever had was maybe 80,000 on the CHIP program.
I thought it was 200,000.
So, but with CHIP, you had just a lot of kids that were able to get their health care through a private pediatrician or the health department if that's where they wanted to go. But they had more options because you had the ability to pay, and for any provider, they've got to get paid. It's everyone in healthcare is trying to do the right thing for the right reasons, but no money, no mission. If you don't have the ability to cover your cost, you don't get to do that for very long.
Well, in the other respect of this, if we did invest, let's just say it cost $300 million more, if we did invest that to the health department, that's not going to be paid for by the federal government like expanding Medicaid.
That's right. That would probably be 100% on the state's dime, as opposed to the state maybe paying $100 million and getting that match, which then you've taken care of.
Not easy, is it?
It's not. It's healthcare is complicated in some ways, but the reality of it is it's really in other ways very simple. It's about providing the right service to the right patient at the right time, and if we can just satisfy everyone's expectations. The providers have an expectation to be able to render their care and get paid, and insurance companies and Medicaid have a expectation to not get ripped off when they pay for services.
I thought I had a lot of doctor friends. I thought I had a lot of doctor friends before, but after with this diagnosis, I've learned the names of a lot more doctors, and I will tell you this: the doctors and nurses are some of the most dedicated people in the world.
Yes.
And when you're there and you see it, they are under the gun. They want to practice medicine and help people. And the red tape is unbelievable. Absolutely unbelievable.
And we've introduced legislation to try to cut back on some of that red tape because ultimately that increases the cost of care for everyone. If a nurse has to chase a payment or get approval, it's expensive there too.
C-Spire text line. My daughter was born back in February of this year, and we went in 11 o'clock on a Thursday. We were discharged Friday morning, got a bill, $34,357.
Wow.
Must have been a beautiful baby.
Wow.
Richard, thank you, sir. Appreciate it very much.
Thank you so much.